Hello, Lacey. How are y'all? Hello, Lacey.
Hi. Good morning, I'm Lacey Nobles with the City of Lubbock. We'll get started with our press conference in just a few seconds. Okay, good morning and thank you for joining us for the City of Lubbock COVID-19 News Conference. We have our regular panelists today, which include Catherine Wells, Director of Public Health, Dr. Ron Cook, Local Health Authority, and Lubbock Mayor Dan Pope. And for an update with the Health Department is Catherine Wells.
Good morning, everyone. Today I'll give you a quick update on our current numbers of COVID-19 cases in Lubbock County, and also talk a little bit about some recent studies that have been released by the CDC that show the effectiveness of face coverings. The department is reporting 4,552 cases of COVID-19 as of yesterday evening, and of these, 2,491 are recovered. 1,682 are considered active cases, and unfortunately we have now seen 66 individuals that have died due to complications of COVID-19. The department continues to report high daily case numbers, but thankfully we are not seeing the large increases that we were over the last few weeks. So we've kind of been at 100 a day, but we're not now seeing 200 a day. So this is a good sign, but we must not become complacent. As I have said before, controlling the spread of COVID-19 requires the entire community. Be smart when you're out. Please frequent businesses that are following the Lubbock Safe guidelines, practice social distancing, and make sure you are appropriately wearing a face covering when you're at work, at the store, or in groups outside your family unit. And also remember, if you test positive, please stay home. Those who are positive need to isolate. That means no work, no school, no sports, no stores for a minimum of 10 days. It is very important that people stay home when they've been diagnosed with COVID. If you're out and about, we don't have a way to stop the spread. We are also starting to see some good news out there about interventions that will reduce the spread. Last Friday, the CDC released a report that looked at the correct use of face coverings to reduce the spread of COVID-19. In May, 139 individuals were exposed to 2 symptomatic hairdressers at a salon in Springfield, Missouri. The CDC epidemiologist then went back and tested 67 of the clients who had had their hair cut by one of these 2 stylists. The good news is that everybody that tested negative. This is really an example of how face coverings can reduce the spread of disease. Both the client and the hairstylist were wearing face coverings appropriately, and we did not see those disease transmission. This really shows that if we can wear those face coverings correctly, we can go about kind of back to normal, be able to participate in different activities and still keep the spread of the virus low in our community. This is really our best defense. I'll go ahead and turn it over to Dr. Cook.
Thank you, Catherine. Appreciate that. I want to talk a little bit today about a few things. Credible data that comes from our science. Sometimes I'm hearing a lot of flack about, well, Dr. Fauci said we don't wear face masks, and now he's saying we're wearing face masks. And then, we're changing that children can't spread the virus. And I'm going to give you news today that children can spread the virus. So why is it that we change back and forth? And it's truly become, after we get more data from credible studies, so we call that credible data, that we can change our mind. Initially we said no face mask because we didn't think that this virus was spread before you were symptomatic. And so we said save the masks for the frontline healthcare workers. And so now we know, and I'll give you more evidence in a minute, that children and people spread this virus before they're symptomatic. So the best thing to do is wear a face mask. And so we get to change. We unfortunately, well, fortunately, we find new data that's credible, and we must change our path to stop this virus. So I'm play a little bit of bad news, good news with you today. I'm going to do bad news first because I like good news last. So bad news is this is a marathon. This virus, although I think we're making a little bit of progress, is going to be here for a while. It may last well into 2021. So for now, we need to keep up the fight. We need to wash our hands, we need to socially distance, and we need to wear our facial covering. You know, the good news is that it looks like we have some drugs that are coming onto the market, vaccines specifically, that have some promising news. They've done the work in the lab, what we call in vitro, and now we're moving to phase 3 clinical trials with some of these drugs, these vaccines, to see if they really work. We're trying to produce antibodies that fight off this infection. We can prove it in the lab, but sometimes what we prove in the lab doesn't work in patients. And so now there are several companies trying to get their vaccines into what we call phase 3 trials, where we actually use these drugs safely in patients to see if they develop antibodies. That's good news. Most vaccines, historically, vaccines have taken 10 to 15 years to develop. This is a global effort, and there's been nothing like this in the past to try to produce a vaccine that's going to make people better. So I think this is good news. It's very early on. We must be patient to make sure that the drug doesn't cause harm, but this is good news. Bad news. There's a study that came out that said vaping is just as bad as smoking and is now considered a risk factor for COVID complications. That's the bad news. The good news is you need to see your PCP if you have trouble stopping vaping, if you have trouble stopping smoking, you need to go see your primary care doctor. We have lots of different ways to help you kick that habit, and it's a very addictive habit. We know that. Nicotine is a terrible drug to be addicted to. So there's lots of things that your primary care physician can help you with. That's the bad news, or that's the good news, that we can help you. The bad news, another bad news, in South Korea, a nation that looked like they did things pretty well as far as this COVID virus is concerned, just came out with a study that said and proved that children and young adults, the ages from 10 to 19, do in fact spread this virus without having any symptoms whatsoever. And so that's where we wear the facial covering again. That's just why we changed to not wearing facial coverings, and now we're saying wearing facial coverings. Is because we do have continued solid evidence that we are shedding virus even for 48 hours or so prior to symptoms. And in this age group, we said children don't spread the virus. We now have evidence that children do spread this virus and may not ever have any symptoms. The good news is this really affects our school-age children, right? 10 to 19. And I know the good news is that I know independent school districts, colleges, universities, school boards, administrators, teachers, and school nurses all working very diligently to trying to make safe return to school a possibility. This is the good news. I know they have been working hundreds, if not thousands of hours trying to make the school where your child is going to return a safe environment by social distancing, by frequent disinfection, and by wearing facial coverings. And yes, children can wear facial coverings without a problem, not a problem whatsoever. It's up to parents to be the good example. And so let me reiterate, how do we wear a facial covering? So I see lots of people wearing facial covering correctly, but I also see a few people not wearing it correctly. So it goes over the nose and over the mouth. Its whole purpose is really to stop transmission of those virus particles out past you, outside your 6-foot bubble. So it must be over the nose. Well, it fogs up my glasses. Well, All you have to do is make sure it's high enough up on your nose, and then pull your glasses down just a little bit, about a finger breadth from where you normally wear them. Yeah, it's a little adjustment to where you see the right spot because I wear multifocal lenses. So now I have to move around a little bit, but my glasses are not fogging up. So I just pull them down just a little bit further. So if any air escapes, it doesn't fog up my lenses, okay? It's be worn above the nose, not below the nose. That doesn't do anybody any good. And it doesn't do any good wearing it under the chin as a chin warmer. It's not a neck gaiter. It is a facial covering that should cover the nose and the mouth and underneath the chin. That's how you wear a facial covering. There's no other way to do it correctly. Lubbock, you're doing a great job, and I think we're starting to see our numbers come down just a little bit. That's because we've worn facial coverings now for a couple of weeks. It may take a little bit longer to see a significant fall, but I think we're headed in the right direction. And if we do these things, if we wear our facial covering, and if we wash our hands and disinfect, and we keep people at 6 foot distance away from us, we're going to whip this virus and hold it off until we can get a vaccine for it, which is not going to be anytime soon. It's going to be a little while. But if we do these things, we can continue to open up Lubbock, but everybody must participate. That's all I have. We're doing a great job. Let's continue to push forward. Wear your facial covering, wash your hands, and keep your social distancing. Mayor, it's up to you.
Thanks, Doc. You were very informative today. We really appreciate you and Ms. Wells and how you guys continue to lead us. So thank you very much. I'm going to start this morning with some data as normal. So let me share my screen. Okay, let's start with hospital data. This has gotten a lot of interest over the last week in our community, as it should. I think two things I would mention. One, the hospitals seem comfortable with where we are. And second, the COVID-19, the number of COVID-19 patients in our hospital over the last 10 days has moderated. It's not grown like it was. You see it in that sort of that range between 100 and 110 patients a day in the hospital. You see the just the new cases versus total tests versus new cases. You see, once again, to Ron's point a minute ago, maybe a bit of moderation. This is maybe a little better look at our positivity rate. You can see these are slides through Sunday. It's the 2 weeks prior to that. You can see that I think there's a really very positive message in the amount of testing that continues to go on in our community. Finally, the case count by age. You'll notice that under 25, we have broken this into different smaller groups. This helps us with information that is instructive to our schools as they look at case counts throughout the community. Although the majority of our cases still are on in citizens under the age of 40, we've seen a little more spread to the rest of the community, which makes sense after the spike we had about a month ago. So my overall comment around our data today is that our numbers are not where I'd like them to be. However, they have improved or moderated over the last 10 days, and I think that our trend line is improving. Okay. Just a few more comments. First of all, we've had some people ask us about on the city website, the new portal, the information that's there. There's a lot more information. It's dynamic. If you'll spend a little time to do some click throughs on it, you'll find that you can learn a lot more about our information. we'll be working on a YouTube to push out in the next day or so that can help everyone better understand that. I want to start with some thank yous today. As a community, we've made a decision to safely reopen. Now, if you travel to other parts of the state or to New Mexico or Colorado, you'll find that we are ahead of them when it comes to reopening. Let me give you a few examples. We're having the Parade of Homes right now. We finished the second weekend. This is sponsored by the West Texas Home Builders. We worked with them literally since March on what this would look like. They're doing a good job. Our citizens that are visiting have participated and gone about it the right way. And I'm thankful for their efforts to keep people safe. I was at the downtown farmers market on Saturday morning. I would say mask compliance was, if not 100%, very, very close to it. That's a big improvement. And I'm thankful for Larry Simmons and the folks that sponsor that event, but our vendors and the people that go there like me to buy your greens and your tomatoes. Our restaurants have done a very good job. And as we've worked with those that needed education or had questions, we've seen compliance really improve. I'm thankful for all of them. I'm also thankful for our large retail, small and large. I think our local retailers have figured this out. And you've seen in the last week where Walmart and COLs and CVS and Best Buy are joining people that were already there, like Starbucks and the Costco, who sort of led the way. Those folks have raised the bar to say masks are required, and it underscores the governor's mandate and what we'd like to do, and it's the right thing to do. Now let me squelch a rumor. I do not wake up in the morning and think first about how excited I am to put on my mask. However, I know that wearing a mask helps protect my family. It helps protect the people that I see during the day. It helps protect my neighbor that I might not see. It's the right thing to do. And that's why I believe West Texans are, some are already there, some are slowly getting there. Folks, we're in this for the long haul. Dr. Cook talked about some of the advances that science is making with vaccines. And even in a best case scenario, we're not going to see those until late this year, and much more likely the first quarter of next year. So as we coexist with coronavirus, as we safely and sensibly live our lives, we're going to have to continue to cover our faces. We're going to have to continue to wash our hands, to try to keep our distance, to hang out with the people that we've been hanging out with. Okay. This is so much of this is about common sense and trying to take precautions to keep yourself and more importantly, the vulnerable members of our population safe. We'll have more good news about testing coming up in the next several days. We will continue to test. We feel like that is critical. But I want to end by saying I appreciate you guys. I'm thankful for your efforts. Please wear your mask. Lacey, back to you.
Thank you, Mayor Pope. Now we're going to open it up for media questions. Today's order is KLBK, Avalanche Journal, Daily Toreador, KMAC, El Editor, KCBD, Latino Lubbock, Texas Tech Public Media, and Fox 34. So we're going to open questions up with Terry Furman with KLBK.
Good morning, everybody. My question is probably for Catherine and Dr. Cook this morning. I want to ask about the fact that, yes, and we showed that study yesterday, Dr. Cook, about South Korea. With kids being able to pass this on and our schools opening up, how involved is the health department and Dr. Cook? How are y'all going to be involved with, I guess, if someone gets it, testing the school and making sure that those kids are safe?
Well, I'll start out and Catherine can follow up. You know, Dr. Douglas Klepper is the medical director for LISD. I'm the medical director for Lubbock Cooper. And we've all been in contact with our school districts and working on their plans to make sure that we can open up safely. You know, it's about wearing facial coverings and social distancing and those sorts of things and frequent sanitation and disinfection. Everybody's got to participate with that. And I know that the teachers are gonna, you know, the first thing they're gonna do is kind of walk over and go over how class is gonna be run this semester for all the school kids. It's just learning a new behavior. And it takes a little while to learn the new behavior. As far as testing is concerned, I'm gonna let Catherine help us with that.
Yeah, we're actually working with LASD and other entities throughout our community to set up pods, groups of individuals that will assist the health department in their contact tracing and coordination efforts for their specific populations. So I'm really excited to get this going, and we've been in conversations with LASD now for months discussing how we're going to do this. So there'll be very strong coordination between contact tracing investigation and the school nurses at each school.
Okay, I guess my follow-up question to this would be, if, you know, a child does get it and, you know, we're having to test other kids or other adults, is that going to be something people have to pay out of pocket? Is it going to be the $500, you know, out of pocket payment, or is it going to be something that a lot of parents can afford, or will it be free?
We will have free testing available through some of the different clinics in town, in addition to people being able to use their insurance to access testing. I don't anticipate testing being a barrier. We've gone into many different facilities and conducted testing at no cost, especially when there's an outbreak.
Okay, very good. Thank you both.
Thank you, Terry. Now we move to Matthew Dotre with the Avalanche Journal.
Good morning, everyone. Just a couple follow-up questions to what Terry was asking. Has that Walgreens free testing site opened yet?
No, it's supposed to open before the 1st of November. They jumped the gun on making their initial announcement, and we're waiting on a confirmation on that, Matt. We should have it this week.
Okay. And then, thank you. Ms. Wells, you talked about how you were kind of partnering with schools for contact tracing. Are you doing the same partnerships with tech, or are they going to be performing their own contact tracing?
Any contact tracing has to be done under the authority of Dr. Cook as our health authority, because that's what legally allows contact tracing to be done. So we're looking at pods that would basically work for the health department and conduct that contact tracing along with our staff. And we are looking at setting that up with Tech, Health Science Center, hopefully Lubbock Christian University. That's the one way we can actually expand our contact tracing capacity to be able to reach everybody in the community.
Okay, so do you essentially train them? Because I'm assuming your staff isn't growing.
Yeah. So they would be trained by us. They would be using the city forms. They would be using the same guidelines for quarantine and isolation.
Okay, thank you.
Okay, now we have Mateo Rosales with the Daily Toreador.
Good morning. So I have two questions. My first question is for Ms. Wells. As students will return in the next coming weeks to Texas Tech, I was wondering, how will the numbers be handled for Texas Tech? Will they be announced separately, or will they be lumped together with the city announcement at 4 o'clock every evening?
I believe we'll have them lumped together with the city announcement because that's everybody that's a resident of Lubbock County, and that's how we'll be reporting it.
And my next question is for either Ms. Wells or Mayor Dan Pope. Like I said, students will be returning within the next couple of weeks, and COVID cases may rise with Tech students returning. Is there a point that the city or the health department may have to step in to tell Texas Tech, hey, y'all have to go online because the cases are getting out of control, or what's y'all thought on that?
That's Mateo, thanks for the question. I can't imagine we would get to that spot. Texas Tech has been, I think, a very responsible and thoughtful in the way they've responded to and planned for this pandemic. They still have many of their employees that are working from home have not been back to the office. They're phasing in the sort of the reignition of the campus. And if we dealt with some kind of scenario like you described, I would imagine together we would work through a plan to address it.
Mateo, let me add in here that I work closely with Tech as well, and they have developed a COVID task force an emergency operations task force to respond and either preemptively work on things to determine the number of students in class and require facial coverings and set up websites and all sorts of things for open communications about where we are and the number and how we respond to COVID cases or COVID patients or students that are positive. Texas Tech is a pod, and that's going to work through the student health services there because that's the medical group that takes care of that patient population. And so the Health Sciences Center also has a pod that we're going to work with for reporting back to Catherine down at the health department.
Okay, thank you, Mateo. Next we go to Matthew Stell with KMAC News.
Thanks, Lacey. I've got a follow up to Terry's earlier question. We talked about students. What if a teacher tests positive for coronavirus? I'm assuming the same thing. They'll still be a pod. They'll still have to go quarantine and isolate. I guess you guys are still trying to figure that out, right, Catherine? Or Dr. Cook?
Yes, absolutely. They'll be treated as any other potential contact or positive case. They'll have to self-quarantine and that sort of thing too. So just remember, this is the important thing here is that we must wear face masks and social distance and do our part so that our teachers don't get infected, because when you have a teacher out for 14 days, now you have a substitute in, and we have wonderful substitute, but it's not the same thing as that primary teacher for that classroom. And so we've got to protect our teachers as well. Kids are going to do pretty well for the most part with this virus. It's the older people like me that may not do as well. So we've got to protect all of our teachers and make sure that they stay healthy too.
Got it. Okay, and I've got just a second follow-up question. Across the state, we've been hearing about there have been some delays in testing, and it's taking a while for some tests to get back. If someone were to go get tested for coronavirus today, realistically, when can they expect to get their results back?
That one really depends on where the test is being conducted. We are very lucky in our community that both UMC and Covenant have rapid testing available. And when Walgreens gets on board, that's going to be rapid testing. So that's immediate, 15 minutes, 15 to 20 minutes. Right now, the turnaround time on the PCR, the test that has to be sent out to the laboratory, is between 24 and 48 hours. That's because we have our LRN lab here at Reese, and then we also have multiple contracts where we can send lab results off to.
Okay, thank you.
Okay, thank you, Matthew. Now we have Olga Aguero with El Editor.
Hello, everybody. Glad to see y'all and thank y'all and May God bless y'all for y'all's efforts that y'all do. And without, Texas and Lubbock, and we go down the line, different counties, we are lucky and blessed to not having a national plan or national leadership to help us with this coronavirus. With that being said, I think a lot of the people have in their mind is going back to school, keeping our teachers safe, keeping our children safe. So with what the doctor had said about frequent sanitizing, does that include that the children or even the teachers, administrators, going and get temperature checks every day? What kind of a system is there going to be set up for the parents to know ahead of time?
Oh, good. Every school district has their own protocol that they're following. I do know that if somebody's symptomatic, that they certainly would test them, and then also probably do temperature testing as well and frequent disinfection. I don't have each one of their protocols in front of me, but I know that they have discussed that.
Okay, with that being said, like if someone is tested positive, well, and that's some questions that we're getting from parents. Are the school going to be closed and be in quarantine, or what are they looking for? And the reason they're asking is that way they can plan for within their job or within their scheduling and things like that. What will happen?
Logan, I think they need to make a backup plan just in case. That's just a good practice, right? But each school is going to have probably a different number. It depends on the number out that day. It depends on the number, how fast it's spreading, or what our city numbers look like, et cetera. So there's not a magic number in there. It'll be just a discussion with the district's medical director, myself, and probably Ms. Wells about how and what we need to do next. Our goal is to keep the school districts open. Kids need to be in school. Now, but we've got to make sure that we do all those other things. Everybody must do their part. Every student, every parent must do their part. I know the school districts are working very hard to create a safe place for our students to return to.
Olga, I want to add to that, Olga, and just say that we need to encourage our parents to expect the guidelines to change. We learn more every day. I believe that the state came out this morning with the University Interscholastic League, UIL, came out with some start dates for sports. It's changed just since we got up this morning. It's going to continue to change. It's unfortunately not black and white. It's a very dynamic, we find ourselves in a very dynamic time. And I think we have to set that expectation that things will continue to change, and we'll make the best decisions we can based on the circumstances we find ourselves in.
Thank you, Mayor.
Next, we have Karen McKay with KCBD.
Have this. Can you hear me now?
Yes.
Yes, ma'am.
I wanted to ask you, Dr. Cook, about the kids with COVID. At the last report, the city said there were 137 children under age 10. So are those kids, according to what we said before, are they asymptomatic, or do they have symptoms? And if so, how many, if any, are in our Lubbock hospitals?
I don't have the numbers for the Lubbock hospitals. We're not given their ages at the time. So that number that you quoted are in the city? I'm sorry, you were breaking up.
The city website said that there were 137 kids from 0 to 9 that had been tested positive for COVID. So I'm wondering, do those kids have symptoms, or are any of them hospitalized?
As far as I know, none of them are hospitalized right now. So, and that's been across the spectrum from the time that we've been testing. So kids do very, very well. And the mortality rate or the death rate is very, very, very low, even in our very young children, even in our babies. And so we either they got tested because they were exposed, or they got tested because there was some suspicion that they might be having some symptoms. And so, but I know of no deaths in Lubbock that I'm familiar with. I may be wrong, but I know of no deaths in Lubbock from a pediatric death.
Also, Dr. Cook, we've seen medical people wearing face shields. Are those effective? Would that be a viable option, say, for teachers, since they would be more comfortable maybe to wear that in the classrooms rather than a mask?
We've talked about that even at Texas Tech, and because you have to broadcast and kids need to see, you know, your mouth move, especially our teachers that teach reading and our language specialists that help kids with speech delay. That's important. It's probably not as good as a facial covering of some kind. It's not, because it's still going to be broadcast. You're still going to, and teaching and talking out loud to broadcast in the classroom is much like singing, which certainly broadcasts the virus particles further. But that's probably the second best thing to do. You know, ultimately a face shield, a clear plastic face shield and a facial covering is the best. Most of us choose just to wear a facial covering. However, a face shield is next best. You know, it also protects the eyes too, because you can actually get infected from having the virus particles land in your eyes. It's a moist environment, great place to grow stuff.
All right, thank you.
Okay, thank you, Karen. Now we have Christy Martinez Garcia with Latino Lubbock.
Good afternoon, everybody. Christy Martinez, Latino Lubbock Magazine. We're seeing spikes in rural communities, even in deaths. And what I want to know is, are there any roundtables or efforts to work collectively with them so that we can assure that we're all on the same page? Plus, you know, as you know, they depend on us and we depend on them. So what efforts, Mayor, are we working on, even Dr. Cook or Catherine, to make sure that we're all on the same page? Because after all, we're the South Plains.
Yeah, Christy, a great question. We meet once a week. South Plains Association of Government has been kind enough to organize a phone call that Councilman Massengale and I sit on every week, and we talk about the issues that confront us. It's with mayors and judges and county judges and city managers or city administrators around the South Plains. We'll continue to do that. We've tried to be a good partner. I'll give you an example. Last week, one of the cities was they're going to have a large softball tournament, and they wanted to know how we had handled the USSSA tournament that we'd had several weekends ago, and we shared our safety plan with them. And actually, it was largely developed by USSSA, but so there is an effort to work cooperatively. It is very important that all the counties surrounding Lubbock, including the part of Lubbock County surrounding the city, take this seriously. We all rely on the same health systems, Covenant and UMC, and so the message needs to be the same. And so we've tried real hard to do that. Thanks for that question.
Mm-hmm. Despite the challenges caused by the pandemic, some local companies continue, well, all of the companies are doing their part in improving how they're serving the customers, as well as adjusting their logistics and requirements that LERT and Safe Lubbock have put on. But some of them feel like they've really been dealt with a very hard blow in this COVID-19 economy. And some businesses are concerned that while they're doing their part to mitigate this virus, Mayor, that you're not being consistent in not placing the same restrictions on special events and concerts that have demonstrated spikes in COVID-19 cases. How are you determining who gets to entertain, what number, and are you being consistent to all the community? I mean, give us an example of the concert number that you cap, or a wedding party number, or who should have to sign up to hold these events? I know it's a lot to ask, but we're hearing a lot from different groups.
Well, let's talk with the facts. I don't think we've denied anybody. I think we've sent a lot of plans back and said, this needs work. I don't think there's no favorites being played. I think as long as somebody can provide a plan that is acceptable to the guidelines that LERT has put in place, then I'm going to approve it. And sometimes it's on the first try, sometimes it takes several tries. The other thing about that is that we're also out trying to help the people that are putting on these events, making certain that they see folks from the fire marshal's office or LPD, just to reinforce how important it is that those guidelines be followed, and really as much as anything to thank them for doing things safely.
But what about the businesses? Because they're still concerned that you're not really.
What businesses are you talking about? I don't understand.
Restaurants, they feel like they're having to do all these requirements. Even someone in retail told me yesterday, we've had to put so much in place, but yet they're holding concerts, and you don't see the same type of effort. So I'm just asking what they're sharing.
We're following the governor's order, and if it's outside the city for a concert, I have nothing to do with that. But I don't know if you've got a specific question. I'd be glad to address it. Like who said what about what event, and if we missed an event, then we'd be glad to look into it.
Thank you, Christy. Now we have Texas Tech Public Media, Sarah Self-Walberg.
Hi, everyone. I joined just a minute or two late, so I apologize if this was covered already, but can we get an update on our nursing homes, specifically the handful that have been recently affected by COVID?
Yeah, I can go ahead and give that. We've had a couple of nursing home outbreaks where we have seen infection among individuals that are residents of those facilities. We are working very closely with those facilities to ensure that all of their residents are tested and that also employees are tested. We've also worked with the state to have inspectors out at facilities to ensure that all of the infection control processes are being followed.
Good deal. And then just to kind of follow up on that, Dr. Cook, last month when you and I talked about cases in younger people, specifically, you told me that the virus getting back into our vulnerable populations like nursing homes made you the most nervous at that point. Now that it's happened, what are your thoughts and kind of what makes y'all, anyone can answer, the most nervous about everything now?
Well, it's like we said before, Sarah, our concern is getting it into especially a vulnerable patient population. Now, there are some new findings in COVID that talk about cardiac complications and chronic lung complications, and even somebody's described it kind of as a brain fog that may last for several weeks, even in an otherwise healthy individual that got it and wasn't hospitalized. So, but in this particular age group, and we know that our loved ones that are in nursing homes are much more vulnerable. They just don't have the compensatory mechanisms to fight the fight that's required to win the battle with COVID. And so that's our scare. I too, like you, am worried that it gets in our nursing homes and it spreads rapidly. That, like we've seen, it spreads rapidly enough, but certainly in nursing homes. Just because the amount of care that our loved ones require, and that's why they're in the nursing homes. They need help with bathing, and they need help with dressing, and it may need help with eating and mobility, and all of those sorts of things requires this close personal contact. It can spread very quickly, as we've seen in our numbers.
Thank you.
Okay, and lastly, we have Blair Sable with Fox 34.
Hi, everyone. Good afternoon. My first question is going to be for Dr. Cook. So you've mentioned, especially with schools coming back into session, that kids do fairly well with the virus from what we understand right now. Is there any concern about students and kids that may have issues? They might have asthma, they might have underlying health problems. Is there any concern about those students and if they are exposed to the virus?
Oh, sure. I think right now, early studies have sort of shown that maybe asthma is not as bad as we thought it might be as a complicating factor. So that's good. However, flu season's coming, allergy season's coming, kids are running and playing hard and their asthma is going to flare. We do worry about giving aerosolized breathing treatments at school, and each school is going to have to, or school district's going to have to address that issue, because what's kicking off their asthma flare? Is it a COVID, an overt COVID viral infection, or is it just their asthma? Well, we don't know. And if they do have a COVID infection ongoing and we haven't sent them home yet, we perhaps may not want to give aerosolized treatments there at the school. So at some school districts, I know they're going to ask that those be done at home or perhaps in the car with the kiddo that has to have those kind of treatments, and not be done at the school where we perhaps may potentially spread those. Those are just some mitigating effects that we can do. So we have to change the way we treat chronic disease and the way we treat certain illnesses, because kiddos may show up and not even be symptomatic, and be carriers, as you said.
Mm-hmm.
Blair, I think the other thing to remember, and I think it's important to point out, is that parents are not required to send their kid back to school. They can attend online. I know that's going to be an opportunity for at Lubbock ISD, Lubbock Cooper, and Friendship. And so it gives the parent the ability to make the best decision for their child.
Thank you. Thank you for that. And then my second question also is going to be for Dr. Cook. So you are also our mask expert. You've been really great on giving us information about what masks we should be wearing, how we should be wearing it, that sort of thing. And I've seen this kind of make the rounds again online, that N95 masks, while they do protect the wearer, they might not be as great for the people around that person wearing that mask. So do you have any information on that? Is there anything that we should know about that? And are there any recommendations with your knowledge about it?
A true N95 mask is very difficult to come by. Even our hospitals, we have some, but they are precious items. Now, there are KN95 masks, and they're a little more rigid mask. It's called a KN95. A true N95 mask must make a seal all the way around, so absolutely no air escapes, that all the air goes in and out through the mask material. And so I don't guess I quite understand that they're not effective, or
do you want me to rephrase it?
Rephrase. Would
that be helpful?
Yes, please.
So I've seen, I believe this is from the World Health Organization, but I would have to check. It's N95 masks, or masks that utilize a valve feature.
Oh.
Does it make more sense now?
Oh, okay. Yeah, the valve feature. So actually, I have one of those, and then I got to look and I said, well, that doesn't do any good. So what that does is it has a little valve that's built into the side. So the one I have is made out of neoprene. It wraps around the face. And so it has an exhaust valve. So you actually blow out through a little rubber seal. It blows out. It doesn't filter anything. It just blows your hot air out. But it seals up as you draw air back in through it. So that may protect you from getting something, but it doesn't do any good if you're infected and you're spreading the virus. So the ones that have the little button valves that you see on the side, those are one-way valves. So when you exhale, it's easier to exhale, but you have to suck air back in through the filtering material. No, those are probably not appropriate but if you're infected, they're not appropriate. It may protect you from getting it, but if you're infected, you're still going to spread the virus because it's blowing out through that valve. Does that make sense?
Yes. So would your recommendation be for people to not use those?
I wouldn't recommend those. Mine are just, I'll use those to mow the yard, but I wouldn't use them to protect me from, or protect you from my illness.
Okay. Thank you for the clarification, Dr.
So
Cook.
I'm glad people are wearing masks. We just need to switch to ones that are two-way filtering and not one-way filtering.
Thank you.
Mm-hmm.
Okay, this concludes our media question and answer. I want to thank you all for joining us, and thank you to our panelists and our interpreter. And for more information on coronavirus in the community, you can go to our dashboard at mylubbock.us/COVID-19. And right now we do have a video on how to navigate the new dashboard on the City of Lubbock Facebook page. So we'll see you next time.